Tick bites can be a matter of life versus death. Today, we're going to talk about something that is in the CDC clinical guidelines that can reduce your risk of Lyme disease and potentially either some other tick-borne illnesses by 87%. It's a medication, it's extremely inexpensive, but the key thing is you have to take it within 72 hours. What we're talking about is the antibiotic doxycycline, which has been around since the 1970s. It's very safe, generally speaking. People use it for acne and lots of other things. And you take 200 milligrams, which is just a single dose, within 72 hours after a tick bite. And the studies show that it can reduce your risk of Lyme disease by 87%, potentially even the other tick-borne illnesses, which I'm going to talk about a little bit later in the video. The reason why I'm familiar with this is my telemedicine company, Shameless Care, mostly deals with sexual health. And this is the exact same protocol as something known as DoxyPEP, which is when you take 200 milligrams of doxycycline within 72 hours after sex, and it reduces your risk of gonorrhea, chlamydia, and syphilis. For syphilis and chlamydia by, you guessed it, 87%. So keep that in mind, because doxycycline is a first-line treatment for chlamydia. Same drug, same dose, same timing, same results. And we're going to talk about that later whenever we talk about would this potentially work against other tick-borne illnesses like Rocky Mountain spotted fever. So my company is all about sexual health, and you will not find post-tick bite prophylaxis in the menu, but we are offering it, and here's why. I'm an outdoorsman myself. Here's a picture of me in the Mark Twain National Forest just a couple of weeks ago where I went on a backpacking trip. And despite me making some precautions like coating my clothes in permethrin, I still got a tick bite. I understand how ferocious these things are and how serious these infections can be. So because we offer DoxyPEP and we can get that to a local pharmacy within a couple of hours in most cases, we can do the exact same thing for post-tick bite prophylaxis. And I'm not sure that other telemedicine companies know what that is or are set up to do it, but we can absolutely get this to you right away. And you can find the link at the bottom of the screen and in the first pinned comments. Again, it's not going to be in the menu. This is just something we're doing because we can and we like to help people. Okay, so what other infections might this work for? An emphasis on might because it's never been studied. It's not in the guidelines. I'm not suggesting that it does work for it, but I am suggesting that these are tick-borne illnesses of which doxycycline is a first-line treatment, just like Lyme disease and just like chlamydia. So it is definitely plausible, but that's all that I'm saying about it. And those would be anaplasmosis, ehrlichiosis, and Rocky Mountain spotted fever. And those are three extremely common and extremely serious tick-borne illnesses in the United States. So again, I hope everybody has a tick-free summer, but if you don't, we can help you at shamelesscare.com. Link is in the first pinned comment. I hope everybody learned something. Feel free to like and subscribe. Thank you so much, and we'll talk soon.